Hello, ladies and gentlemen. The title of our project is Clinical Care for Electrical Stimulation in Physiotherapy and Rehabilitation. Our project is funded by Erasmus+. The institution that our project is coordinated with is Pamukkale University. Other partner institutions of our project are Hatay Mustafa Kemal University, University of Craiova, Başkent University, Süleyman Demirel University, Sierra State University of Applied Science, Burdur Mehmet Akif Ersoy University. Association partner of our project are Turkish Physiotherapy Association, Order of Physiotherapy in Romania, Lithuanian Physiotherapy Association, Estonian Association of Physiotherapy. I will tell you about the title for patients with neurologic problems, which belong to Module 3 with the scope of our project. We prepared this chapter with Nilüfer Çetişli Korkmaz. Electrical stimulation intervention are non-invasive treatments that take into account physiotherapy and rehabilitation intervention with electrical currents. Electric stimulation is widely preferred in clinical intervention for the symptom management of neurological disease. Today, electrical stimulation is used for the management of many neurological symptoms, such as reducing pain, regulating spasticity, during immobility, moderating muscle tone, accelerating bed sore healing, like this. In this part, electrical stimulation approach are explained with the scope of the rehabilitation of symptoms caused by neurological disease. First, when you look pain, more recent advances in basic and clinical neuroscience have shown pain as a very common symptom of neurological disease. The idea that changes in sensory systems are the predominant process in pain has been replaced by the conceptualization of pain as a very complex central nervous system, condition in which sensory system activation patterns are abnormally integrated with activity in other brain systems. More recently, clinicians and researchers have concluded that in many cases, chronic pain is a direct consequence of neurological disease or can even be considered an integral part of the underlying disease. The rate of pain seen in neurological disease is as follows. 57 of Alzheimer's disease, 8 to 14 of stroke, 89 of Guillain-Barré, 40 to 60 of Parkinson's disease, like this. Non-invasive electrical stimulation methods are often preferred in pain management in physiotherapy and rehabilitation clinics. Electrical stimulation protocol that can be used for pain management in neurological disease. For example, high-frequency transcutaneous electrical nerve stimulation, frequency 110 Hz, pulse duration 200 milliseconds, and intensity the maximum current that can be tolerated without muscle contraction. When you check low frequency transcutaneous electrical nerve stimulation, frequency 4 Hz, pulse duration 200 milliseconds, and intensity started from 0 to a muscle contraction threshold of each subject. It can be twice a day for 45 minutes, 5 days a week for 6 weeks. Microcurrent electrical stimulation frequency should be 30 Hz, pulse duration 300 milliseconds, and intensity the maximum current that can be tolerated without muscle contraction. And its application protocol is 50 minutes a day, uh, 5 days a week for 3 weeks. Dynamic currents, the fast fix 2 minutes, monophase fix 3 minutes, long period 3 minutes, and short period 2 minutes. Its application protocol is 10 minutes a day, 10 sessions over 2 weeks. Interferal current frequency should be 100 Hz for the first 15 minutes, 80 Hz for the next 5 minutes, and intensity applicable sensation. Its application protocol 20 minutes a day, 5 days a week for 3 weeks. That's can be changed 1 or 3 weeks. When you look, spasticity is a common symptom that affects people with long-term neurological condition such as stroke, MS, and traumatic brain injury and spinal cord injury. Spasticity has been defined as irregular sensory motor control resulting from an central nervous system lesion manifesting an intermittent or sustained involuntary activation of muscles. A systematic review of 24 studies on the epidemiology of leg spasticity reported a prevalence of 28, 38 in stroke patient, 45 to 66 in MS patient, and 13 in patient with traumatic brain injury. Spasticity management requires balanced approach that weighs the benefit of treatment against the benefits of spasticity. For these reasons, spasticity management is important in neurological disease. Current intervention to treat spasticity like a solid evidence based on guidelines often rely on expert advice. Electrical stimulation protocol can be used for spasticity management in neurological disease. High frequency transcutaneous electrical nerve stimulation. This feature of electrotherapy method, frequency 100 Hz, pulse duration 200 milliseconds, and intensity 2-3 times the sensor threshold, and application protocol 30 minutes a day, 5 days a week for 6 weeks. Low frequency transcutaneous electrical nerve stimulation, frequency 1.7 Hz, pulse duration 200 milliseconds, and intensity. The stimulation intensity increases until a visible muscle contraction. Application protocol 60 minutes a day, 5 days a week for the 3 months. Functional electrical stimulation frequency 35 Hz, pulse duration 300 milliseconds, and intensity. The stimulation intensity is increased until a visible muscle contraction occurs. Application protocol is 3 minutes a day, 3 days a week for 3 weeks. For example, Russian currents, 2500 Hz carrier frequency, 50 Hz moderated frequency, and 200 millisecond fast duration for 10 second on period followed by a 50 second off period. Application protocol is 10 minutes a day, 5 days a week for 6 weeks. Paralysis and loss of strength. Paralysis is defined as a reduction in voluntary motor unit requirement. For example, the inability or difficulty to voluntarily recruit skeletal motor units to generate torque or movement. The injury of the higher centers can impair central voluntary motor command at various levels, which can be grouped into higher, middle, and lower command levels. Paralysis is important symptom affected stroke, spinal cord injury, MS, and cerebral palsy. In physiotherapy and rehabilitation programs, different electrical stimulation methods are used in this paralysis and strange doses. Neuromuscular electrical stimulation current is feature of the electrical method. Frequency 35 Hz, 250 millisecond amplitude, and current lasted for 5 seconds and then stopped for 5 days. Intensity stimulation was determined so that the subject could be this muscle contraction without feeling tired. Application protocol is 30 minutes a day, 5 days a week for 3 weeks. For example, transcutaneous electrical nerve stimulation, frequency 500 Hz, pulse duration 200 milliseconds, and intensity with 3 times the sensor threshold. Application protocol is 30 minutes a day, 5 days a week for 4 weeks. Pulse galvanic current stimulation, for example, is its feature of electrical method is a monophasic waveform with a pulse duration of 100 milliseconds and interpulse interval of 300 milliseconds and a pulse rate of 2.5 Hz. And its application protocol is 30 minutes a day, 5 days a week for 6 weeks. Tremor is involuntary rhythmic oscillation of mutually interrelated antagonist muscle group that causes of body part to move around fixed plane in space. Although tremor is frequently seen in Parkinson's disease, its prevalence is estimated to be 0.3%, increasing to 1% in individuals aged 60 years and older. The prevalence of resting tremor 58% is higher than that, and action tremor is 39%. It's difficult to actually estimate the incidence and prevalence of tremor in MS, but one study found moderate and severe tremor in 32% and 6% of patients, respectively. In physiotherapy and rehabilitation program, different electrical stimulation methods are used in this tremor. For example, functional electrical stimulation feature is frequency 30 Hz, 250 millisecond amplitude, and the current lasted for 5 seconds and then stopped for 5 seconds. Intensity stimulation was determined so that the subject could feel the muscles contraction without feeling tired. Application protocol 30 minutes a day, 5 days a week for 3 weeks. So, sensor electrical stimulation feature is frequency 50 Hz, 250 millisecond amplitude, and current lasted for 5 seconds and then stopped for 5 seconds. Pulse amplitude with a comfortable level producing motor response of less than 20 milliampere. Application protocol 30 minutes a day, 5 days a week for 3 weeks. And then bladder and bowel problems. Neurological diseases that affect the brain structure and spinal tract that are under the control of the sphincter, and sphincter may cause lower urinary tract symptoms. Among lower urinary tract symptoms, overactive bladder syndrome may include urgent, frequent urination, nocturia, and urine incontinence. Urinary incontinence has been reported to occur in stroke, Parkinson's disease, peripheral neuropathy, and MS. Up to 80% of spinal cord injury patients, up to 70 of people with MS, and about 10% of people with Parkinson's disease complain of constipation. In this part, the electrical stimulation methods used for bladder and bowel problems are maintained. When we look TENS for urinary incontinence, TENS feature is frequency 75 Hz, 70 millisecond amplitude and intensity at 16 milliampere. Application protocol is 3 minutes, 30 minutes a day, 5 days a week for 6 weeks. The positive electrode should be placed on the second lumbar spinosus process, and the negative electrode should be placed on the medial side of the middle and lower third of the junction between the posterior superior iliac spine and the ischial node. Neuromuscular electrical stimulation for lower urinary tract symptoms, and nameless feature is frequency 10 Hz, 200 millisecond amplitude, and the stimulation amplitude should be reduced to level just below the motor contraction threshold. Application protocol is 30 minutes a day, 5 days a week for 12 weeks. It should be applied to the vaginal wall at the level of the levator and muscles with a vaginal stimulating probe. When we look indication is constipation. We chose functional electrical stimulation for this problem. Functional electrical stimulation is frequency 40 Hz, 330 millisecond amplitude and intensity 40 or 50 milliampere. And application protocol is 15 minutes twice a day for the first 2 days. Then the treatment session is increased to 30 minutes twice a day, 5 days a week for 6 weeks. Electrodes should be placed on the external oblique and transverse abdominal muscles. Pressure ulcers are defined as an area of localized damage to the skin and underlying tissue caused by sustained mechanical load. Today, pressure sores are important health problem with serious consequences for the patient, directly affected by the increase in morbidity, mortality, and deterioration in the quality of life. Every effort must be oriented in this direction, especially when it is estimated that almost 95% of pressure ulcers are preventable and 60% of occasions are initiated and developed in hospitals. In conclusion, It is stated that electrical stimulation applications support the treatment of pressure ulcers, especially for a better and faster clinic, vascularization, and subsequent healing of ulcer. Uh, High voltage pulse galvanic stimulation is using for ulcers, and this current features is the should be applied to deliver twin peak monophasic pulse current with 100 Hz with a 10, 50, 100 millisecond pulse width, 2-second ramp up time in a continuous mode, and with the intensity set between 50 and 150 volt. Application protocol is 60 minutes a day, 5 days a week for 12 weeks. Our references like this. Thank you for attention. See you again. Have a nice day.